Good morning, everyone. I'm Corey Langer, Director of Thoracic Oncology at the University of Pennsylvania and co-chair of the Med-Onc Committee of the Energy Cooperative Group. So it's my distinct pleasure to present the results of our randomized phase 2 study of pemetrexed with or without pembrolizumab in first-line therapy of advanced non-small cell, a cohort of much larger KEYNOTE-021 trial. My disclosures are shown here. By way of background, patients who with non-small cell do not demonstrate actionable markers, either EGFR mutation or ALK or ROS1 translocations, are generally treated with first-line platinum-based combination chemotherapy. As you've heard from Dr. Reck, pembrolizumab, an anti-PD-1 monoclonal antibody that has shown activity as a single agent in patients with advanced pre-treated non-small cell. And it's approved in the EU for treating patients with advanced PD-L1 expressing non-small cell that has progressed on one or more prior chemotherapy regimens. So adding pembro to chemotherapy may improve efficacy because the therapies have complementary mechanisms of action and generally non-overlapping toxicities. Our study schema is shown here. Key eligibility criteria included treatment-naive, advanced stage 3B or 4 non-squamous, non-small cell lung cancer, absence of activating EGFR mutation or ALK translocation, good performance status, no active CNS metastasis, no antecedent interstitial lung disease or pneumonitis requiring systemic steroids, and provision of a tissue sample adequate for PD-L1 assessment. Patients were randomized and stratified for but not selected by PD-L1 status, and the results of that PD-L1 status were blinded to the individual investigators. The control arm featured carboplatin at AUC of 5 with pemetrexed 500 milligrams per meter squared every 3 weeks for 4 cycles. The investigational arm added pembrolizumab to that regimen at a flat dose of 200 milligrams every 3 weeks for up to 2 years. Both arms featured maintenance therapy with pemetrexed single agent indefinitely, and the control arm was allowed to cross over to single agent pembrolizumab at the time of disease progression. The primary endpoint was overall response rate as evaluated by a blinded independent central review. The key secondary endpoint was progression-free survival, and the other secondary endpoints included overall survival, safety, and relationship between PD-L1 status and anti-tumor activity. After 10.6 months follow-up, 47% remain on pembrolizumab, and 31% are still receiving chemotherapy, and 51% in the chemo arm have received subsequent pembro or other checkpoint inhibitors. This is for the control group. The results are shown here. On the left, we have a response rate that is superior for the combination, 55% for combined pembrolizumab and chemotherapy, compared to 29% for chemotherapy alone. This was highly significant. And progression-free survival is also significantly improved for the combination with a hazard ratio of 0.53 and a p-value of 0.0102. At 6 months, 77% are free from progression in the pembro combination compared to 63% in the control group. And the median progression-free survival for the pembro chemo combination is over a year. It's 13 months compared to 8.9 months for chemotherapy alone. Again, the p-value for the response benefit is 0.0016. If we look at time on treatment, median of 8 months for the pembro chemo combo compared to 4.9 months for chemotherapy alone. We do see a higher incidence of grade 3 and 4 toxicity at 39% for the pembro combination compared to 26% for chemotherapy alone. But this does not translate into any difference in treatment discontinuation or deaths on study as shown here. The side effect profile is basically as expected that you would see with pembrolizumab and platinum-based combinations. No major surprises. So in summary, adding pembrolizumab to standard carboplatin pemetrexed in non-squamous non-small cell nearly doubles the chance of having a response to treatment and reduces the risk of progression or death by nearly 50% over standard chemotherapy alone, carbo and pemetrexed. Pembrolizumab in combination with carboplatin pemetrexed is tolerable, has a readily manageable side effect profile, and this combination could eventually be an effective treatment option for patients with chemotherapy-naive advanced non-squamous non-small cell. There is an ongoing prospective randomized phase 3 trial, 189, that is essentially the phase 3 version of what I've just presented, with PFS as the primary endpoint, including crossover in the control arm. The results of this trial have just been published in Lancet Oncology. I don't know if we have handouts for that, but it will be available in the exhibit hall when that opens, the Lancet Oncology booth. Thank you very much.